During menopause, estrogen production slows, and then stops. When that happens, a number of changes, many of them unwelcome, happen in a woman's body. Periods become irregular and then stop. You may have hot flashes, mood swings, a deeper voice, and an increase in facial hair. Vaginal dryness is another common symptom of menopause, and close to 1 out of every 3 women experiences it while going through the change. And it becomes even more common after menopause. Vaginal dryness also can occur at any age from a number of different causes. It may seem like a minor irritation, but the lack of vaginal moisture can have a huge impact on your sex life. Fortunately, several treatments are available to relieve vaginal dryness. What causes vaginal dryness? Normally, the walls of the vagina stay lubricated with a thin layer of clear fluid. The hormone estrogen helps maintain that fluid, and keeps the lining of the vagina healthy, thick, and elastic. During menopause, the drop in estrogen levels reduces the amount of moisture available. It also makes the vagina thinner and less elastic. This is called vaginal atrophy. In addition to menopause, estrogen levels can drop from childbirth and breastfeeding, radiation or chemotherapy treatment for cancer, surgical removal of the ovaries, anti-estrogen medications used to treat uterine fibroids or endometriosis. Other causes of vaginal dryness include Sjogren's syndrome, an autoimmune disorder that attacks cells in the body that produce moisture, allergy and cold medications, and certain antidepressants. Douching, lack of enough foreplay before sexual intercourse. No matter what the cause, vaginal dryness can be extremely uncomfortable. It can lead to itching, burning, and painful intercourse. How is vaginal dryness diagnosed? Any burning, itching, or discomfort in the vaginal area warrants a call to your doctor or gynecologist. The doctor will take a health history, and find out how long you've been experiencing symptoms, and whether anything, such as douching or taking medication, seems to worsen them. Third-party ad content. Your doctor will then do a pelvic exam, checking your vagina for any thinning or redness. The exam will help rule out other possible causes for your discomfort, including a vaginal or urinary tract infection. The doctor may also do a pap test to remove and test cells from your vaginal wall or cervix. Continued. How is vaginal dryness treated? The most common treatment for vaginal dryness due to low estrogen levels is topical estrogen therapy. Topical estrogen replaces some of the hormone your body is no longer making. That helps relieve vaginal symptoms, but it doesn't put as much estrogen in your bloodstream as oral estrogen hormone therapy, HT. Most women use one of 3 types of vaginal estrogen. Vaginal estrogen ring, S-ring. You or your doctor inserts this soft, flexible ring into the vagina. There it releases a steady stream of estrogen directly to the vaginal tissues. The ring is replaced every 3 months. Vaginal estrogen tablet, Vagifem. You use a disposable applicator to insert a tablet into your vagina once a day for the first 2 weeks of treatment. Then you insert it twice a week until you no longer need it. Vaginal estrogen cream, Estrus, Premarin. You use an applicator to insert the cream into your vagina. You will typically apply the cream daily for 1 to 2 weeks, then reduce the frequency to 1 to 3 times a week as directed by your doctor. Any type of estrogen product can have side effects, such as vaginal bleeding and breast pain. Topical estrogen may not be recommended for women who have breast cancer, especially if they are taking an aromatase inhibitor. To women with a history of endometrial cancer. To women who have undiagnosed vaginal bleeding. To pregnant or breastfeeding women. There isn't much research on the long-term use of topical estrogen, but doctors believe it is safe to use in the long term. In order to keep the vagina more lubricated, try using a vaginal moisturizer, Replens, which you can buy at your local drugstore or supermarket. You can make intercourse more enjoyable by applying a water-based lubricant, Astroglide, KY, beforehand. Also take your time before having sex to make sure that you are fully relaxed and aroused. Avoid using douches, bubble baths, scented soaps, and lotions around the sensitive vaginal area. These products can worsen dryness. You know it's important to do regular breast self-exams to check for lumps or other changes. But did you know a vaginal self-exam can be just as important? It can help you find unusual changes earlier than if you waited for your regularly scheduled checkup. If you do find a problem, you can start treatment sooner, and you'll more likely have a better outcome. What to look for? A self-exam isn't as in-depth as a pelvic exam performed by your gynecologist. You should still have routine pelvic exams. These check for ovarian cysts, sexually transmitted diseases, STDs, uterine fibroids, early-stage cancer, and other signs of health problems. But a self-exam may help you find signs of an STD or changes to your vulva, the outer part of your genitals, that could signal other health problems. Spots, sores, or bumps could be early signs of vulvar cancer, and should be checked by your doctor. A more involved self-exam could also help you detect changes to your vaginal wall, and possibly your cervix. How do I do a vaginal self-exam? You can do it anytime, but it's best when you're in between periods. Don't use any vaginal creams or douches for at least 24 hours before doing the exam. Here are some things that you can use that will help. A handheld mirror. A flashlight or other small light. A detailed diagram of the genitals with all the parts labeled, so you'll know what you're looking at. Pillows and a towel. Third-party ad content. Make sure your hands are clean or that you're wearing sterile gloves. Be mindful of your fingernails. Remove your clothes from the waist down. Sit on your bed or on a towel on the floor against a wall with your back propped up by pillows. Pull your feet toward your butt and spread your legs. Relax your pelvic muscles. Then examine the parts of the vulva, the clitoris, and the outer and inner labia. Take note of the color and size of each part, so if anything changes you'll notice it easily. You may need to pull back slightly on the hood of the clitoris. You might also have to spread apart your pubic hair to get a clear view of the area. Continued. To do a more complete self-exam, gently spread the labia apart and angle the mirror and light so you can see into the vagina. The walls should be pinkish in color. If you're comfortable, place your finger inside your vagina, and feel along the vaginal wall. You may notice it feels a little like the roof of your mouth. If you push a little farther, you may feel your cervix. It feels like the tip of your nose. If you're not comfortable with this much probing, it's okay. You can do a simple visual inspection. Just be sure you see your gynecologist for your regular pelvic exams. How often you have pelvic exams may depend on your age, health history, and other factors. Ask your doctor about what's right for you. When to call a doctor. If, during your vaginal self-exam, you see any genital warts, sores, bumps, spots, or unusual coloration, make an appointment to see your doctor. The same is true if you notice a smelly discharge. A small amount of non-smelly discharge is normal. It might be lighter or heavier, depending on where you are in your cycle. If you do find a problem, remember, the earlier it's diagnosed and treated, the sooner you'll feel better and find peace of mind.